southern Maidu people to the north, the valley and plains Miwok peoples to the south of the American River, and Patwin Winton peoples to the west of the Sacramento River. We would also like to honor the Wilton Rancheria, the only federally recognized tribe in Sacramento County. We acknowledge that we are standing on the tribal lands of Sacramento's indigenous people. Okay, so thank you so much. And today, I would like to first say why we are here. So why we are here, today marks the 3-year anniversary of Daniel Denoyer's death. Danny Denoyer drove himself into the Mohawk River on April 9th, 2019 because his insurance was suspended by Fidelis Care over a $20 payment that he accidentally missed, which effectively cut off his access to the medication that he desperately needed. So since that day, Scott Denoyer and Anna Denoyer, the parents of Danny's, they've been fighting, fighting a for-profit healthcare system of healthcare in this country. And today, they were in front of Fidelis data center in Amherst, New York, protesting. And across the nation, a bunch of other cities, people protesting in honor of Danny and 68,000 and plus people who lose their lives, who die annually for lack of health care. So today we are gathered here, our friends, our colleagues in healthcare justice movement, and also other movements, to really say say no to for-profit system of healthcare, and we demand our lawmakers. That's why we are in front of the Capitol. Our lawmakers immediate action to give us healthcare, healthcare for all people in this nation. Okay, so I'm going to bring up the first speaker, and I have to prepare your bio, actually. Hold on, let's see. Yes, okay, so Maureen Cruz, and I'm so glad that you're here. She actually drove up from LA. I know. Thank you so much, you're a great friend. So Maureen Cruz, RN, was a research associate at UCLA's Neuropsychiatric Institute and is a former public health clinic nurse with the LA County Department Health Services. Currently Director of Healthcare for All Los Angeles chapter, Maureen works in solidarity with many social justice organizations and coalition partners, Physicians for National Health Program and California National Nurses United. Ms. Cruz was a member of the California Progressive Caucus Delegates State Healthcare Strategy Team and was the Progressive Democrats of Los Angeles Healthcare Liaison. Grassroots volunteer efforts spanning over 50 years include issues of social justice and human rights, public education, disaster relief, and anti-war activism. Ms. Cruz organizes and participates in community forums, interviews, and workshops to help educate the public and encourage participation in the movement for single-payer universal healthcare. Everybody in, nobody out. Thank you, Maureen.
Thank you so much, Sakura. Really appreciate it. I'm honored to be here with all of you. The best thing about being an activist is all the fabulous people that I get to spend time with. Yay! I hail from the occupied lands of Tonga and Keech, which is Los Angeles. And we are asking all communities, including our governing bodies, to respect the indigenous people and to learn the true history of the lands on which we reside. And we resolve to work with all indigenous people in the state of California and to build a shared sustainable future for all. That's from Los Angeles for the Tongva and Quiche and all the native peoples of this state. I have to flip this 1 second. Okay, this is going to be my maiden voyage reading this off of my phone. 1 second. Okay, now it doesn't want to go sideways, so okay, here we go. Sorry. Yeah, for 1 second. Yeah. Sorry, it was sideways before.
It's okay. I've never actually read
it.
anything off my phone either. We are in that.
I'm an old person, so forgive me. Patience. Okay. So, a nurse mistakenly gives an incorrect drug that kills a patient and is convicted of homicide with a sentence of 8 years in prison. An unintentional error committed by someone dedicated to doing good and helping care for the vulnerable. An accident, severely punished. Health industry corporate executives knowingly, routinely, purposefully design a system that kills at least 100,000 people a year for profit. Every year, 30 times the 9/11 death toll. An annual mass murder by design. Nobody is indicted. By industry design, many more millions are delayed and denied care and left to become sicker and disabled. For the crime of inflicting great bodily harm, nobody is indicted. U.S. corporate health insurance system relies on disaster opportunism to exploit our human need at our most vulnerable for financial gain. 23 million people are mired in significant medical debt. 75% of those with debt have health insurance. 70 million Americans go without the basics such as food, medicine, shelter in order to afford health care. 40 million Americans self-ration needed care to avoid medical debt. Your money or your life by design is extortion. Nobody is indicted. Almost 90% of Americans have health insurance. We pay premiums, co-pays, deductibles, and yet struggle to get the care we need because what we have is not really covered by the insurance that we pay for. Insurance is not health care, and it does not guarantee care. Paying for something and not getting it is a scam. 70% of healthcare costs are publicly funded, and at least 30% of that money is extracted away from the delivery of healthcare for profit. That is an enormous theft from the public treasury, our treasury, by design. No one is indicted. Adversely affecting 14 million Californians, these destructive policies ravage entire communities across the state, turning them into healthcare deserts with high rates of poverty, debt, preventable disabilities, stark health disparities, and unnecessary deaths. Primarily, people of color and the poor are suffering lethal consequences under a racist, separate, and unequal publicly funded system. Penthouse care for some, bargain basement care for others, and absolutely no care for the very unlucky. Unequal care is exclusionary, and it is a violation of the 14th Amendment. Separate is never equal. Separate is apartheid. Our system is de facto racist and classist, and many of us believe unconstitutional. No one is indicted for these predatory crimes against humanity. Rather, generous multi-million-dollar salaries and ever-growing shareholder profits are the reward for the cruelty of calculating how to systematically increase massive human misery and injustice for profit. Using human beings as profit centers, extracting as much as possible, giving as little as possible, hijacking professional judgment, squeezing employees, stripping facilities of resources, and ultimately discarding those lives no longer profitable is nothing less than a criminal racket run by industry gangsters. This system-wide criminal conspiracy to degrade harm for profit can only continue with government complicity. That's why we are here. Legislators are the accomplices enabling these crimes. They are driving the proverbial getaway car, and some are receiving big payola to do that. This is what we can and must change. In California, the recent CalCare AB 1400 was our 8th attempt at legislation in 24 years. We are closer every time, and we will be back in 2023 with CalCare. But before then, we need to make some essential changes in November. It will take dedication, it will take work, it will take outreach, it will take heart. But together we are going to change who controls this system by changing those in the system. We must elect new legislators and send our message to those remaining that we are not going away. The current system is brutal, it's barbaric, it's dysfunctional, and it is immoral. We want and we deserve the same care that we provide for the legislators. Anything less is intolerable. Our lives depend on creating a just, single-payer, universal system. Everybody in, nobody out, equally. We need humanistic health care. It is just, it is a human right, a public good, fiscally responsible, democratic, and it is morally correct. We need the justice of single payer, and we are going to fight for it. How many people here are going to fight for it? Woo! Woo! Thank you all, and thanks for being here. It's really wonderful to be among you.
Thank you so much, Maureen. Wow, thank you so much. So yeah, so did you see the signs that people holding like behind Maureen? So yeah, Governor Newsom, 2 million number, you know, I mean, okay, well, it's gone now, but 2 million, he takes over 2 million, he has taken actually, to be accurate, he has taken over $2 million from healthcare and the pharmaceutical industries over 10 years, but $2 million. And it actually, these like 7 signs that we have here, I call it $1 million club, because it's like all these people have taken over $1 million. So, later, Barbara comments, we'll talk about, you know, how to expose people, you know, our politicians who take money from the industry and how they are corrupting the decision making up at the Capitol and also the federal level. Okay, so next speaker I'm gonna bring up is Mark Van Landwit. So he has a long resume, but he sent me just a summary of it, so I'm just gonna read it. So he is our Revolution East Bay Director, Sierra Club Mount Diablo Chair, Bay Area Green New Deal Alliance co-founder and former Vice Chair for the CDP Progressive Caucus, and dedicated universal healthcare advocate. Thank you so much, Mark.
Thank you. And thank you all for being here. When I say, how do you feel? You say powerful. How do you feel? Powerful. How do you feel? Powerful. How do you feel? Powerful. You are powerful. We are powerful. This movement is powerful. We are the movement that is going to win single-payer, universal health care for California, for Washington, for New York, and for the entire nation. And we are here today, on this very windy day, because we can't wait. We can't wait for politicians, We can't wait for the system to change its status quo for us. And it's appropriate that we're in front of the state capitol because this is what we need to bypass. We need to bypass the Assembly and the Senate. We need to bypass the lobbyists. We need to bypass the politicians. No more false promises, no more betrayals, no more backroom deals. We need to put single-payer, universal health care on the ballot. We need to take this fight directly to the people. So, that means we're gonna have to mobilize. We're gonna have to mobilize and mobilize and mobilize. I have secured the funding to put single-payer, universal health care to fulfill the paperwork. But then comes the real fight. Then comes the real fight. We're gonna have Big Pharma, the insurance companies, the California Medical Association. They will pour millions and millions of their blood money into fighting us. And I say that we should welcome that fight. We should welcome that fight. I'd rather have this battle out in the open where we can see them. Are you ready to have that fight? Yes! All right. And the fight is going to be exciting. It's going to be the most important fight that all of us will ever engage in our lifetime. In California, we have over 70% of the people support single-payer health care. In 2020, Bernie Sanders won California by over 400,000 more votes than the rest of the Democratic primary field. In California, we have over 50% of Republicans who support single-payer. We got to put our time and our energy into democracy, into democracy. And I want us to keep in our minds about all the lives that are going to be saved, all the lives that can be started, all the lives that do not have to go through any more of the needless suffering of this immoral system. And always feel the urgency of the moment. Every day we let this immoral system continue. It's another neighbor gone. It's another family member gone. It's another child gone. So thank you for being part of this movement. Every movement needs a beating heart filled with love, filled with empathy, and filled with righteous anger. And I want to thank you for being that beating heart. How do you feel? Powerful. How do you feel? Powerful. How do you feel? Powerful. Health care for all. Thank you all.
Thank you, Mark.
Thank you.
Thank you so much, Mark. Yeah, I just wanted to say one thing. So I'm originally from Japan. I've been in this country for 31 years, but we have universal healthcare in Japan, right? So not to like rub it in on people, but no, really, that's not my intention. But it just blows my mind that people in this country are duped. Duped to think that this is normal. It's not. In most of the world, it's not normal. In Japan, and you probably ask me like why I'm here, but in Japan, you just go to doctor, whenever you don't even think about it, and you probably pay. I mean, I've heard people complaining that they paid $10. That's expensive for people in Japan. So I actually believe I'm 50 years old. I'm going to be 51 this year, but I really do believe that this is achievable. Healthcare for all is achievable in my lifetime, and I'm not gonna wait until I turn 60. Okay, I'll be out here protesting with you guys until we win. We are not stopping. Okay. So on that note, I'm going to bring up my dear friend Barbara Cummins. She drove up from San Francisco. Actually, okay, Mark drove up from East Bay, right?
Train.
Oh, okay, all right. Okay, so Barbara has been my confidant, my advisor since day one. because I'm actually pretty new in this movement. I just started last year. So, but Barbara has been fighting, just like Maureen, for all her life. So great respect to you guys. And so Barbara's gonna talk about good stuff, money.
Thank you. I'm so grateful for you all being here because each one of you is going to hear something. Each one of you will hear something and take it back to somebody else. And this is how it goes. The healthcare situation is really getting bad because it's being privatized. Privatized means instead of us owning it, private corporations are owning it. And they're mostly about profit. So we have a system where profit first, care maybe.
Okay.
All right? Okay. That's our situation, okay? How many people here know that healthcare is on Wall Street? Okay, right. I've got a chart here. Here it is. Here's the chart. Can you see what happens on this graph? Straight up, okay? And it started in 2010. And you know why 2010? The ACA passed, and with the insurance mandate, and people started turning 65 at the rate of 10,000 a day in this country, the baby boomers. So that continued from 2010 until 2029. We've got another 10 years of people turning 65 at 10,000 a day. So it's like open hunting season for money, because all these seniors are going to need Part D drug plans, et cetera, et cetera. And between that and the insurance mandate and sort of the license given to these entities to do as they please, there's very little regulation in this. So healthcare is now one of the top 4 sectors on Wall Street. And it's been this way for the last 10 years. All right? So where does this money come from? Okay, it comes from Medicare taxes that you have all paid throughout your working life. The FICA tax, okay? It comes from government subsidies, which comes out of your taxes. Most of the Affordable Care Act is subsidized, quite a bit. I don't know the figures, but quite a bit. And then the third entity is what you pull out of your pocket to pay for your health care. Premiums, co-pays, and god-awful deductibles, okay? So we want to do something a lot better, and we have to. I just read recently that our life expectancy is 5 years behind the European countries. We are getting worse with it, they're getting better, okay? Even wealthy people are at risk in this system. Another article I read. So it's, it's the for-profit nature of our system is literally killing people. And we can't let that go on. Everybody knows this. You know it. You have your own stories. I started in this about 20 years ago when I had an asthma patient die in the middle of the night because he wasn't using his controller asthma inhaler. He couldn't afford it. Okay, he left behind an 8-year-old kid. All right? He was taking oral prednisone to control his asthma, and he lost his natural cortisol protection mechanism, and he died. That turned me into this because then I found out that pharmaceuticals are making billions, and they've had a chance to regulate their drugs, and they haven't done it. They haven't done it. They keep saying they're going to do it, but they can't. So we're going to have to make them give us something better. And we've been waiting 50 years for this. Medicare was always meant for everybody, but the AMA stepped in and blocked it. And then they had to backtrack and only give it to people 65 and over. We've been waiting 56 years to get this right. And we can't go on any longer. We've lost too many people with COVID. either from having COVID or perhaps even avoiding health care because we did not have a good public health structure in place. All right? It hasn't always been this way. I know I've been a public health nurse for a while, and I know it has been better, but it's getting really, really bad. Okay, we can't go on. We're in the wealthiest country in the world. We can afford this, and we shouldn't have to wait 3 or 4 years to do it. Medicare was implemented in 6 months without computers. Everybody 65 and over had it in 6 months. So we can do this. Okay, now, one of the obstructions is the money that you see right here. Okay? They're taking it from the health and insurance industries regularly. And the higher their level of government, the more they take. All right? We have to stop this. Each of you can call your legislator and ask them to stop taking this money so we can trust them. We can't trust them when they're taking this money. Just like our bill failed, this is part of the reason, the money. Even the Democratic Party has taken in the last 10 years $16 million a year from these industries, health and insurance industries. Okay, so it's sort of like a cancer, sort of like a malignancy that's getting worse and worse. All right? So, what do? We're going to come up with a pledge. We're looking for a sponsor organization that wants to sign on with us. We want to build a list of people that we can CC, and we're going to ask our legislators to stop taking this money, put it on their website. We know from Bernie Sanders' campaign, he didn't take corporate money, and he almost made the presidency, right? So we know it can happen. They don't need this money. It's graft. It's immoral. Borderline criminal, really. Yeah,
It's
right.
not borderline.
Right.
It's criminal. 304 criminal, yes.
Yeah. So, anyhow, you personally can call your legislator, and if you're interested, I will do a search on Follow the Money and email it to you so you know where your legislator is. We would have had the signs up, but my frame broke. All right, so if you want to come up and write your name and your email and where you live, I'll look up your legislator and send his profile so you know if he takes a lot of money and what he takes. Okay? And I'll just set that there. Okay, and yeah, so the money, the people that are giving it are corporations and also nonprofits. There's many nonprofits that are against Medicare for All. The AMA they're starting to soften. California Medical Association, these are nonprofits, but they are working hand in hand, giving money to stop this. So any organization you're involved with, okay? And as far as the investing goes, you know, a lot of people have this in their 401ks. You know, I don't want to see people lose their retirement allowance, but if somebody has an alternative to health care, maybe climate energy needs their capital. Maybe people can divest from the health care and put their capital in the climate sector. I'm not sure what sector that is, but that's one solution. So if you're in finance and you want to work on something like that, creating a healthy way for people to divest without losing their money, please think about that, okay? All right, so I think I've said enough.
Thank you, Barbara.
One more statement. So this is the vision. We want one people, one plan. No more of this multi-payer wasting money on whatever administration. One people, one plan. Okay? and we want it disconnected from employment. We do not want workers dependent on their employer for health care. So just think about the freedom that would give our labor force. All right? So that's my vision, and I hope it's yours, and I hope you've learned something. And if you have any questions, feel free to come up to me. Thank you so much for being here.
Thank you, Barbara.
Thank you so much, Barbara, and thank you so much for offering your personal assistant. I just want to say, Pat the Banner, known as Pat, as known as Pat the Banner for Punch Up Pod, is actually live streaming this today. Thank you so much, Pat. So people outside of California are watching this too, and it's not only California's problem. So one of our demands for this action is get the money, corporate money, out of politics. So as Barbara said, whoever is here today, call your legislator, call your representatives, demand that they take a pledge not to take corporate money. And that goes to people who are watching outside of California as well. You can do this. This is the action that you can do personally. Call your representatives, ask them, demand them, they not take corporate money anymore, or else. I'm part of the movement called Dump the Incumbents. We are trying to actually promote this idea. We have a voting power. I became a citizen of this country 3 years ago because I wanted directly involved. I want to get directly involved in the politics of this nation. I wanted to say in where it's going. So we can vote, right? I mean, many of us can vote. So if your representatives currently are taking corporate money, you can vote them out. We can vote them out. So as long as corporate money is, in the politics, we are not getting what we want. So on that note, actually, there are 3 candidates for various offices that we invited here to speak. And this is actually by no way endorsement, okay? I don't want you guys to misunderstand us. It's not endorsement, but they wanted to speak in solidarity with, Danny Denoyer and Scott and Anna Denoyer, New York Health Act, and what we are trying to do in California. So I'm going to bring up 3 candidates for here to speak, but first is, I'm just gonna bring up your profile. So Rose Penelope E. I'm just gonna actually summarize your bio, but so Rose is the CEO of Green Retirement, a California benefit corporation focused on fossil-free and socially and environmentally responsible 401ks. The firm has advised more than 90 retirement plans across the country and guided thousands of working people to save for their 401ks in a way that's aligned with their values. And she is also running for Congress in California District 1. And her campaign is centered on healthcare for all, college and trade schools for all, and jobs for all. She believes in being fair, just, and kind, but is tenacious and not afraid to fight. If elected, she strongly resolves to do the necessary legislative work as well as engage in direct action to advance these issues. So, Rose, thank you so much.
Thank you, Sakura. And indeed, as Barbara mentioned, there's power. We have power in various ways, and indeed the 401k is a way that we can express our power. So I know Mark is from Our Revolution, which came from Bernie's campaign, I believe. Who else here were Bernie supporters? So, so I was a Bernie supporter in 2015, 2016. I actually met Bernie in 2014 in when he came to the B Corp event in Burlington, Vermont. And I whispered to him that he should run for president. And you know what? He took my advice. So there he goes. He went and ran for president. And of course, like many of you, was very disappointed that he lost due to the shenanigans of the Democratic Party, right? And then we saw AOC, we saw the squad come up and get elected. And again, hopes were up. Were your hopes up to when AOC got elected? Well, mine were. And then waited and waited and waited and nothing. And then another election, and Cory Bush and Jamal Bowman both got elected. So candidates that I was supporting, that I was like retweeting, donating money to, and I finally thought, well, now we have 2 more members of the squad. Now they will do something. And then force the vote happened. Did it happen?
No.
No, force the vote didn't happen. Did we hear anything from them?
No.
Did they ask Speaker Pelosi? Did they bargain with her not to vote for her and to put the Medicare for all on the floor for a vote? No, they didn't, right? So I was disappointed. I was heartbroken. And then we had the Medicare for All March. Did AOC say anything about the Medicare for All March? Did any of them do anything? Nope, nope, nada. And so I got madder and madder. And I was at home, I was watering my plants, and I was thinking, darn it, why doesn't anybody step up? Why isn't somebody putting their heads, their necks out there for Medicare for all, for healthcare for all, that we all so need? And then, of course, I answered myself. I said, well, there's nobody. And then I asked myself, well, why are you asking somebody to do it? Why are you hoping somebody to do it if you're not willing to do it yourself? So that was the germ of the idea. I tried to let go of it. It wouldn't let go of me. And so I am not a politician, but because I am mad, I am upset. We don't have a government that we deserve. We deserve better. We deserve health care. That is why I am running. And I'm running as an independent because I believe that both parties have been bought by corporations. I mean, take a look at all of this. And Barbara's work, thank you, Barbara, for doing this. We clearly see that both parties have been bought. So we know Einstein's definition of insanity, right? You keep doing the same thing over and over again and expecting different results. That's never going to happen. So keeping ourselves within that system of the duopoly is not going to get us anywhere. And I know it's like tilting at windmills what I'm doing. Nobody knows who I am. I don't have a party, a machinery to help me. Can you just imagine how hard it was to go from county to county? There are 10 counties in District 1 where you have to file a statement of information if you want your name on the voter guide. Without party machinery, it's like you're like all awash, like just trying to do something. But you know what? It's worth it. It's worth it so that we don't have any more parents suffering like Scott and Anna are. It's worth it so that we don't have kids dying like Scott did. It's worth it so that we won't have 68,000 people die every year due to medical neglect, or what do you call that, Marian? You know it more than I do. The 68,000 that die every year.
Because I know it's 68,000.
Because of
more, that's a very conservative estimate.
Yeah, so conservative estimate of 68,000 dying because of lack of health care. We are the United States of America. We deserve better, and that's why I'm running. Thank you.
Thank you, Rose. So I'm going to bring up next Harpreet Chima. And I'm just, okay. Harpreet Chima is a Democrat running for U.S. House of Representatives to represent California's 9th Congressional District. Harpreet organized coalitions to support Green New Deal legislation alongside his fellow union members at UPTE CWA 9119 He helped raise money for undocumented families for COVID-19 relief when our government let them down. Now he's helping lead an effort for the non-police first responders call Stockton program. As our U.S. representative, Harpreet will fight to make our government work for working families. Thank you so much, Harpreet.
All right, thank you everyone for coming out. So I'm going to start this speech, and it's going to be about some of the more of the obstacles that we're up against, because it's not just health insurance companies, unfortunately. People have talked about our healthcare being tied to our employer. And let's be clear, it's one of the most barbaric aspects of our healthcare system. Your boss already controls your paycheck, already controls your ability to keep a roof over your family's head, your ability to put food on the table. But how much workplace abuse is happening throughout this country? How much shit do workers have to take because their boss also controls their access to their healthcare, for them, for their spouse, for their kids? But it's also about giant hospital chains buying up private practices, buying up other chains, consolidating into giant machines that are almost impossible to take on. And then we have pharmacy benefit managers. They're the middlemen between drug manufacturers and health insurance companies and you. And 3 PBMs, they control 80% or 85% of the market, which lets them pay low prices to the drug manufacturers, charge high prices to the insurance companies, prices that then get passed on to you. So 20% of all profit made in the pharmaceutical industry goes to these guys, and they're doing nothing but sitting in the middle. And then we have private equity firms, whose number one goal is to buy up businesses, cut costs, whether it's payroll, whether it's actually taking care of patients, and then generate a profit off of that. They're buying up hospitals and nursing homes and private practices, basically anything they can get their grubby hands on. And they're cutting corners, and they're pushing staff to the limits, making nurses take care of more patients than they can take care of. And when a nurse inevitably makes a mistake, they're the ones that end up paying for it. And they're shutting down hospitals and clinics in rural parts of the country where they have no other access to health care. And then we have the Biden administration, who's continuing the Trump legacy of letting Medicare become privatized through direct contracting entities, but now they changed the name to ACO REACH. It's the same program.
That's right.
They're basically putting in another middleman who takes our taxpayer dollars from Medicare and then pockets whatever they don't spend. So they prioritize not giving seniors the care that they actually need. But even up against all of this, I know we can win. They've gotten away with it for this long because they've bought up politicians. They've spread their propaganda through our media, through advertising, through think tanks, and economists who, for some reason, always end up siding with the people that cut their paychecks. But they've pushed people to the breaking point.
That's right.
At the end of the day, propaganda is just words. It doesn't work when reality is hitting you in the face every single day. People are watching their loved ones die due to lack of health care.
Keep going, brother. Keep going.
And when people don't feel well, they're not just worried about getting better, they're worried about bankrupting their families in the process. But the American people don't take this kind of abuse laying down. Folks like you are taking matters into their own hands, organizing rallies just like this one, bringing neighbors and friends and family into the fold, countering the spin that the mainstream media puts out. And you're holding politicians accountable due to their inaction. People are realizing it doesn't matter if you're a Democrat or a Republican or an independent, or you don't care about voting. At the end of the day, it's the same boot on all of our necks, and it's literally squeezing the life out of us.
Woo! That's right.
But getting the right people into Congress or the Capitol isn't enough. The people need to lead this fight, because the other side, Capitol, is gonna fight dirty. They'll spend every cent they have to stop this movement. You'll go to sutterhealth.org, and they'll be in bright red font saying, if you pass single payer, your access to healthcare will be gone. It's what Uber did with Prop 22, putting their message in the app, scaring voters into voting the wrong way. They'll threaten capital strikes, threaten to shut down the hospitals and the clinics if we pass single payer, because we aren't going to let them bleed us dry. But that's why rallies like this are important. So people are aware of what's really happening, of what the fight is going to look like. And so when politicians in Congress do try to pass single payer, they're bringing people along with them. What we need are more politicians who are transparent about the process that happens in Congress. What we don't need is for Congress to be a black box where we don't get told if a vote's gonna happen, if it's not gonna happen, why we aren't forcing the vote. Because at the end of the day, if you're a progressive in Congress, if you're trying to fight for single payer, you need the people on your side and they need to be aware of what is happening. Because I can promise you on the other side, the lobbyists and the industry, they know exactly what is happening in the halls of Congress. We should too.
That's right.
And look, this is a simplistic way of talking about America's history, and I know we have dark parts of our history. But the American people, in my opinion, have their own legacy. We overthrew the divine right of kings and declared our independence. We broke the shackles of slavery. We defeated fascism. So don't tell me that a bunch of executives and billionaires who literally go on TV and cry at the mention of a wealth tax are going to stop us now. We are going to pass single payer so we can go to the doctor or the specialist that we want, go to the hospital that we want, go to the pharmacy that we want. We're going to expand Medicare so it includes hearing and dental and vision for seniors and for everyone. We're going to make sure nurses and hospital staff are properly taken care of, they have safe working conditions, they have safe staffing ratios, and we're going to implement free at-home care for everyone. And we're going to root out systems that prioritize profits over care. And look, I understand this event isn't partisan, so I'm not going to tell you who to vote for. But I will say this. Our bosses have plenty of politicians in Congress. Let's stop sending them more. Let's vote for working class candidates, for candidates who have been involved in union organizing and grassroots organizing, politicians who are going to fight for the many, not the few. Thank you.
Thank you so much, Harpreet. Yeah, thank you. Okay, so I'm going to bring up Megan Adams next. So Megan Adams is running for California's state treasurer as is a Peace and Freedom Party candidate under the central slogan, "End Poverty in California." Over the past 15 years, Adams has continuously contributed to and stood up for her community. Adams is a long-time anti-war and anti-racist activist with the Answer Coalition. Adams is running in 2022 as part of a statewide left unity slate composed of candidates from the Peace and Freedom and Green parties. Her campaign is also endorsed by the Party for Socialism and Liberation, of which she is a member. The Adams campaign is not funded by corporate donors, real estate developers, or oil lobbyists. Her campaign is funded by the people. She runs grassroots campaigns built by people power, organizing movements for justice and fighting to envision a socialist future. And her bio says, "We must work hard to cover many expenses." Oh, okay. I'm not gonna read that part. Yeah, that was like directly sent it to me by your campaign. So anyway.
Thank you. And I just want to say, I mean, it's been really great being here and just listening to all of the stories that people have been sharing here. And actually, it made me start thinking about one that we had, of just an example, which I have to say, thankfully, is not like so many others, for talking about the 68,000 minimum. And I agree, that's absolutely a minimum of those who die because they do not have coverage, not counting all of those who put off care because they can't afford it. That they can't take time off of work, that they can't afford their medical bills. And I feel like we all have stories that we can tell about when we had to put something off, or our family or our friends did. So like, I know one of my friends is right now, she had a medical emergency and is trying to pay off a $20,000 debt. So she's working every single day, 7 days a week in order to try to cover her rent in San Francisco and pay off this debt. And the story that I thought of mine is, like so many others, I got laid off during COVID. I'm a school bus driver in San Francisco, and we spent 2 months fighting to get our employer the school district that contracts with us to extend the health care, because while the schools were all closed and we're all being laid off, this was all before there were vaccines, right as everything was at the height of things, and they cut all 300 of us off of our health care because it was like, no, this isn't our responsibility, it's somebody else's. And so all of us got cut off. And I was one of those probably many people that got laid off and said, can I actually afford to do Covered California? Can I afford, if I'm on unemployment, to enroll in a healthcare system that I'm paying for out of pocket? And I was one of the many, I'm sure, that made the choice to not. I put it off because it was a gamble to risk that I hope I don't get COVID or I don't get sick, but I can't afford to pay $300 in a month when I'm living off of unemployment and I don't know when I'll be called back to work. I don't know how long I'll be living off unemployment. And I know that that's absolutely a story, not just that is so similar for those that are, for those that I work with, those in the state, and those across the country that were really having to struggle through these last several years of the pandemic. And so that was just kind of mine of thinking about really what is the impact of healthcare, that we do all think of, that we all have those stories for it. So just to kind of talk about, unfortunately, one of the other colleagues, one of my colleagues who's on the flyer that we were passing out, Natalie Reese, is running for insurance commissioner, saying healthcare for all and abolish the insurance companies. That is her slogan. And that it is so quick that if you go up and walk to people and say, hey, will you support me? We want to abolish the insurance companies. How fast people turn and say, absolutely. That is what we need. That, if we're talking about the statistic of, I think someone said it's 70%, I'm sure that's also minimum, in the state support single payer healthcare. That's because people know how absolutely expensive it is to go into the doctor. And then if you're on minimum wage, how little it covers you of if you do have something employed by your provided by your employer. And so just to talk about that, it's absolutely shocking, for talking about mine, for why we picked it for ending poverty in California, is because I think it almost feels shocking, but California has the highest poverty rate in the country. And at the same time, we are the wealthiest state in the country. I read that and this is based off of 2019-2020 statistics from the census, that if California was an independent country, it would be the 5th wealthiest in the world, above India and the United Kingdom. And yet, how many people go past people who are sleeping out in sleeping bags or tents on the street? How many people put off healthcare because they can't afford it? How many people are having to line up still to get food because they can't afford the food, are having to struggle every single day? And so, for looking at it, that the stats say that 17% of the people in this state live in poverty, and it's another 18% that are near. So that's 34%, over a third of Californians live at or near poverty. And that with all the safety nets that we had here, if that was, we do have fairly strong safety nets in California. If they weren't as strong, that number would be higher and it'd be closer to 40. You're talking about 15 million people in this state alone who are struggling, because I know I live pretty close to paycheck, and I think that's true for probably most people here. That's true for most of our neighbors and our family members, that it's a struggle. And if you miss a paycheck and that could put you out on the street, that means you're part of that 34% or the nearly 40%. This is part of our struggle. And so that's why we wanted to focus on this, of the fact that, what we need is not the money going into the insurance companies. We don't need the investment for talking about the 401ks and all of the retirement funds that are going into fossil fuels and all sorts of things that are continuing to exploit the environment. That what we need is to actually look and support people who are putting the priority on what do people need. We need housing. We need affordable housing. We need people to be able to get medical services, to get healthcare access, to get mental health care if that's what they need, to really address the needs of the people, to address the fact that education is underfunded, that childcare should be free, that the things that are essential, just like healthcare, that are rights, that are essential to our ability to live, is something that should be guaranteed to us. And so that's why I'm out here, and I wish Natalie could be here too, to say that this is why we're out here in this fight, why we need healthcare to be for all. That this needs to be something that you don't have to walk in there and wonder, how much is the bill going to be when I get out of the emergency room? How much is this going to cost me? Can I do it? Because it's still, even though that the reason that they say that poverty is the highest in California is because of the high housing costs, the number one reason why people go bankrupt is because of a medical emergency. And so these are things that we absolutely need to take on. And so that is why we took on the slogan demanding to end poverty in California. That if we talk about this, we can talk about all of those things that we need to be doing. I'm up from San Francisco and I live in the Tenderloin. So for anybody who knows about what's been going on down there, so I moved into the Tenderloin about the time that our mayor called a state of emergency and flooded our streets with cops to target those that are out on the street. And instead of providing mental health services, instead of actually trying to address it and work with groups that are actively engaged with those who are living on the streets, that she flooded it with police. And that's not what we need. We don't need cops patrolling our streets, brutalizing people who are just trying to make a living, for people who, for many of those that they're unemployed, that people who are undocumented, who have no way in this system to be able to provide for themselves or their families. So I do hope that you get involved. Please do take a flyer. I hope that you support us, support me, support the Left Unity slate, and that what we need to be demanding, as I said, is healthcare for all. So I'm gonna say it. What do we want? Healthcare for all. What do we want?
Healthcare for all.
What do we want?
Healthcare for all.
And let's fight to make it real. Thank you.
Thanks so much. Okay, so we are going to a visual as a part of this program, but I am going to actually bring up Dr. William Bernstein. He is another, one of these people who dedicated his life to healthcare justice movement and activism. And again, he has a long bio, so I have to kind of, okay, I'm not gonna do it then. but what I'm excited about, having him right here is he's going to talk about culture, I believe. And I have a flyer here, which I will distribute. And this is actually the vision of what could be, and very exciting. So thank you.
I'm just so awed at the beauty of the people who have spoken up to now. Everybody brings such an enormous drama, such an enormous understanding and insight into what we are all suffering. I would like to take a different tack. Long time ago, as an organizer, I realized that the last thing that I should be spending my time on is fixing problems. And I decided that I would only be committed to making solutions in our society. The greatest problem that we face in moving our agenda of making sure that everybody has health care is us, our timidity, our lack of understanding and having the organizational framework in order to move 1, 2, 3 million people that are going to have to be moved concretely in order to deal with the opposition from the cartels and from the major corporations that essentially are sucking our blood. I spent the last year with 40 colleagues from around the country crafting an imaginary system of what a healthcare system should be like, because nothing that we have now is healthcare. It's all medical wealth care. And when people talk about our healthcare being broken, I look at it and I say to myself, our healthcare is absolutely impeccably perfect. It's doing exactly what it's designed to do. And so the question is, what would a healthcare system really consist of? And so we put together a program based on two experiences that I have, and I'm going to be very frank with you, even though I know it's controversial. Number one, I've spent a lot of time in Cuba, and I've never seen a more beautiful, humane, connected system of healthcare in the world compared to what's going on in Cuba. None of the healthcare providers has to pay a dime for tuition. They work with a small number of families in their neighborhoods that don't exceed 800 families. The care is completely free, and the country has had our foot on their neck for over 50 years because we can't afford to allow the rest of the world to see what a truly socialized, humane, democratic system is really all about. Secondly, I worked in a world where I was dealing with people with profound mental and physical disabilities. And that whole world has been institutionalized through the use of Medicaid. Medicaid is one of the cruelest, most antisocial, anti-family structures, policies in our country. And so that work of looking at what it would take to socially valorize the most stigmatized, the most different, the most devalued, the most dependent people in society, which turn out to be, interestingly enough, us. Because as we age, we become part of that community. We become part of that shoot into institutions. Medicaid funds the American institutional system, which means congregate, segregated, devaluing, violent services that result in the reduction in lifespan, the reduction in power in society and engagement. So the program that I put together was called the California Lifetime Care, rather than long-term care, program. Long-term care is Medicaid. Lifetime care is building circles of community and family to participate in individualized planning to deflect each of us as we become dependent from institutional placement. And the only way to get rid of the trillions of dollars that have been sunk into Medicare and to come to grips with this massive institutional culture that we live in right now, massive culture. Nursing homes, assisted living, hospice programs, they're all over, and people don't have a memory of what it was like before 1964, when we didn't have that institutional system. And so the agenda has been to invite the imagination of my comrades, my colleagues that I've been working with all across the nation to frame the California Lifetime Healthcare Act, which is, the acronym is called CALTCHA, C-A-L-T-C-H-A. And there's a website, calcha.org. In that model is everything we could possibly imagine that would transform our lives towards healthcare. Number one, we need to have the system owned by the people, not by the corporations. That is going to take a phenomenal organizational agenda and movement in order to make that happen. We're talking about us going against billions of callous, cruel, arrogant people that essentially own and benefit from that system. Secondly, we need to look at the transformation of the workforce. Our workforce is not servicing us properly. They treat us as a commodity. They're forced to be complicit in the system. And so we have to change the way in which care is delivered, which means building an army of direct service personnel to do a bunch of things that we don't even talk about. Right now, there are 41 million, mostly women of color, who are taking care of family members who are dependent and cannot go to work and are not being paid to do that. There is no benefit for them to do that other than family bonds. We have to change that. We have to figure out a way in which to have people funded to become healthcare workers through a global budgeting for all post-secondary public education systems. That means all the colleges and all the universities that are cranking out doctors, nurses, dentists, social workers, psychologists, therapists, and the whole range of healthcare workers have to be funded tuition-free and they have to exchange year for year to become part of a California health corps that has to be created that would then assign people to health deserts at the urban and at the rural level in order to meet the needs of people. And the chances are that when people who care about caring are in places that are not particularly happy to be in, and they work there and they become friendly and become knowledgeable of the folks in that community, they'll probably stay there. And we will redistribute the workforce. Third, we need to decentralize the empires. We've got to have services in the home, on the street, in the neighborhood. That means that Kaiser, Dignity, Sutter, UC Davis, all of these gigantic multi-billion-dollar empires that are sitting out there concentrated in these gigantic architectural, spaces have to be completely decentralized so that we have services at the local community level. Studies have been done to show that where there was redlining and essentially forcing people of color into ghetto areas, that there are not assets in those areas in the greater Sacramento metropolitan area in order to service those folks. And so people like Kaiser and Dignity and Sutter are building their multi-billion-dollar systems outside of the urban areas of Sacramento, because they know if they put a clinic in an area where there's nothing there, they will build an economy around that clinic, because where there's healthcare services being delivered, economy grows around that particular facility. So the question of meaningful employment, the question of local, meaningful, intimately accessible healthcare delivery systems has to be looked at very carefully. We need to be thoughtful about the moral foundation of the delivery system. There is no piece of legislation in existence up to now. So I'm 83, I've been in this thing for 60, 70 years watching what's been happening. We were part of a colleague of mine and myself essentially hammered Prop 186, which was the first proposition that we put out in 1994. That proposition came as a result of us stopping talking with people that were veterans in the movement, because it was a waste of time to talk with people that were just talking about the situation and didn't convert their ideas to a document. So we need to have a major policy vision, a document, something that has words on paper that people can argue about and look at and essentially refine and develop so that it becomes really a meaningful foundation for the change. We have to build unity across hundreds of thousands, millions of people in the state of California to fight our enemies. Now, there's a timeline. There's only two ways for this to happen. One, we can have a piece of law come, either from the federal level or from the California legislature, in order to have a system that changes the way in which money flows and the way in which services are organized. Two, we have to have a proposition. We have to go to a direct vote for the people, bypass this, bypass this, and go to a vote. The only way we can have either of those two things happening, the third way, of course, is a revolution. It's just, overthrowing the government, with force or whatever we have to do. And that's the third possibility, but that's a little bit off for a while. So let's look at the second possibility, or even the first possibility. The only way we can have a law passed, either by proposition or by the legislature, is in an election year. That means 2024, 2026, 2028. We can't do it in between. We can't make this happen by stamping our feet and being pissed off. We have to understand that we have a timeline. So the question is, when do we show ourselves to our opponents that we mean business and we have the capacity to challenge and overcome them? Will we be able to have that million potential people that are inoculated against the propaganda that's going to come by 2024? I don't think so. I don't think so. Listen, I want this shit to happen tomorrow. Look, I'm an old man, I've got Waldenstrom's macroglobulinemia, and I'm fine, but I'm going to croak at some point. I'd like to see a solution, the way Megan wants to see a solution. We've seen what COVID has done. COVID stripped bare the whole empty foundation of coverage. We have to stop thinking about cost. The solution to this problem has nothing whatsoever to do with cost. It has to do with policy. And the policy is intimately connected to 1 or 2 or 3 or 4 million people in California that we have to count on to go to the polls and vote. And so for those of you that are thinking about playing a role in this ultimate struggle, which people have correctly said is the single most important public policy that we will ever see in our lifetimes, because it has to do with climate change, it has to do with democracy, it has to do with home and social community development, it has to do with every aspect of quality of life in our system. I don't want to go on too long, but I just want to tell you, go to calcha.org and look at it, and then pass it around. We don't need endorsements. I'm not looking for people to say, take this. I'm looking for people to say, fix this. See how you fit in. See how your church fits in. See how your organization fits in, and open a debate with your colleagues about what would make it better. What would make that document better? Because if we have a document that builds the kind of unity that we need, moral, social, passionate conviction about this is what a healthcare system would look like, we will be able to make our move. It is not going to come soon, it's not going to come easy, and it's going to depend upon gentle and timid people like us, that have trouble going and knocking next door many times in order to talk to our neighbors, because we're not encouraged to be social, civic, or political in our culture. We have a culture that divides us, that shatters us, that atomizes us. And so the object here is to think about what kind of political, social machinery do we have to build to transform the public electorate? Because there's not a third way. I'm telling you, either you're going to have to do what they did over here on the street, gunning down everybody on 10th, with rifles and what all, or we're going to have to go to the people for a vote, and we can only go so often, and we have to go with a capacity to compete against the television and the billboards, because that the oligarchy, our oligarchy, will not chintz on anything in order to discredit us and defeat us, defeat our efforts. They play chess, and we play tiddlywinks up to now. So we have to go to a new crowd. We have to talk to new people. We have to mobilize new organizations that we have a trusted relationship with in order to come with the solution. The solution clearly is universal single-payer healthcare, short of socialized medicine. Remember, we got the VA system here in the United States, which is a national health care system, not single payer, national health care. Everybody that works for the VA gets a check from the federal government. That means that the government owns the health care delivery system, that is the Veterans Administration. We're talking about something bigger, more complicated, because people have no invitation to imagine, they have no invitation to risk, they have no invitation to bond with one another, although we know in our heart of hearts that we crave to have that kind of relationship with one another. We crave to have that relationship, and so we have to be confident about how this works. The stuff that Maureen talked about, the stuff that each of the speakers spoke about is profound. The stuff that Mark said, the stuff that Yi said, the stuff that Megan said, that Chima said, all that's all true. We got to work on what is the solution now. And the solution isn't going to be easy. It's not going to be fast. We have to be very objective and cool and cold about this thing and know that we're fighting against the entire capitalist system. Capitalism won't, fall over if we have single-payer health care, but the people will become immensely stronger and immensely more profoundly connected and deeply bonded in a much different way. We have to change the delivery system. We have to change our culture. CalCHA is that bid that we have proposed to be considered and embraced and potentially organized around in order to move our campaign. So I want to thank you very much. I want to thank Forrest for this incredible work. Yes, it's CalCHA, CalTCHA.org, the California Lifetime Care Health Act.org, calcha.org. All right, and I passed the paper around. If you don't have the paper, we just submitted a proposal to the Poor People's Campaign because the root of our problem is exactly what Megan is saying. Poverty. That's the ground zero of everything that's hurting our nation. We are colonized. When we talk about here's who were the native communities that owned this land, they were colonized, and that colonization resulted in their destruction, their genocide. We are colonized to be exploited and monetized because of our needs and because of our health problems, our health challenges, right? So the language that we use becomes very, very important. You don't want to talk about the healthcare system when we don't have a healthcare system. We got to make that distinction. We have a medical welfare system. And don't use the term health unless you're talking about health. And don't talk about health unless you understand what the hell you're talking about in terms of really transforming our society, right? So the language is crucial. Are you holding your hand up? Yes. Ask me. Yes.
Why not give the people the choice instead of taking over any health insurance? Give the American people, let's try.
Take off your mask and let me hear you say it.
I have lupus and I'm on pedicine. Listen, give the people the choice. Give them a choice for Medicare for all. When?
How and under what's the tool for the choice? Exactly right. Did I not say that?
Yes.
That's the point. That's the point.
Taking over. Let them, because within a year's time, I bet you half of people to go into Medicare for all.
You're absolutely, listen, I get Medicare. I mean, I've had millions of dollars of care. I've had multiple open heart surgery, chest, hip replacement. I haven't paid a penny. I agree. The question is when, and when have we done our work? If you can't tell me for sure that you have 1 million people that are gonna go along with what you want, then we're gonna get beaten. And I don't want to get beaten anymore. We've got to make this one count.
Q&A after.
Okay? So thank you very much for your patience. I apologize for talking too much if I did. We have great work to do. We have great historical work to do together. And we will make this happen because the country cannot afford to continue on the path that it is on. The services will be unaffordable and the economy will collapse because our industrial community is paying 20% more than any other country in the world because of the medical insurance coverage over which they have no control of its inflation that they have to deal with. And Chima's talking about that. He understands that in his bone marrow. So the people that are running for office now have to be supported. Let me just tell you one last thing. I am not going to lift a finger to do anything to influence the existing Congress or the existing legislature. It is a waste of my time. Every phone call I make to a legislator, I could be making to somebody to move something that we can count on that's more real, even though it may not come easily. But we know for sure that these guys are not going to support us. So even though Rendon is coming out of office and Wood is coming out, yeah, you know, I mean, these people are going to be turned over, but there's a line a mile long to replace them with other corrupt people that are willing to stay with the oligarchy. We are colonized. We are struggling against an oligarchy in America that's every bit as savage as what's going on in Ukraine right now, and we need to take spirit and hope and model the work that's going on now in Europe, in Eastern Europe. Thank you very much.
Thank you, Thank you so much. So I'm going to bring up Desiree Rojas, and I'm just really excited that she joined us. Thank you so much for answering my call, and she's representing Labor Council for Latin American Advancement and California Progressive Alliance. And next month, May 1st, there's a May Day rally. I think she's gonna talk about that too, but it's from 10 a.m., right, Desiree? Yeah, 10 a.m. at 681 West Capitol Avenue, and I'll be up here again to join them. So yeah, very exciting. Thank you so much.
My goodness, it's getting hotter. Hotter in temperature and hotter in our commitment for change, right? Me llamo Desiree Rojas, soy la presidente. My name is Desiree Rojas, I'm the president of Labor Council for Latin American Advancement, Sacramento chapter. And before this building, and of course, on our native people's land, I am a native woman. Yo soy Chicana. I come from 3 different tribes. And it was beautiful to hear the land acknowledgement. But I'd also like to remind everybody that until Leonard Peltier is free, none of us are free. There's a sign that was up here in Spanish that talked about that, you know, healthcare, how important healthcare was. I wish it was still up here. I echo everything that everyone has to say, and I'm not going to keep it very long. But what I am going to say is that on May 1st, on International Workers' Day, we're going to walk over that yellow bridge out of SEIU 2015, and we're going to walk to the Democratic headquarters building on S Street, and we are going to remind them how much they have failed the working class in this state and in this country. When my tío, Dr. Braxton, said that the system is failing us, I just want you to visualize something real quick. And this is more for the viewers who are watching this film, not for the people here, because you know this already. But those who are watching this film are going to resonate with this as well. The system is so broken that the elderly who paid their dues, their taxes, who have been overworked, can't even afford dentures. They cannot afford glasses. Because the system is so broken that they make them take out a $2,000 credit online there in the dentist's office to get their teeth caps or they get dentures. How do I know? Because that happened to my mother, and that's happening to a lot of elderly people in the 5th largest economy in the world and in this nation. The problem is that when Anthony Rondon, a traitor, bring his sign up here. Give it to me. This man right here froze SB 562. He took the fall when corporations said, and the governor said, I don't want that bill on my desk. You take the fall. He froze that bill. But that bill would have set us up socially, economically, and stable-wise before a pandemic. Here, I can't stand the thought of holding this picture. It would have set us up, stabilized our state, and it could have set off a domino effect across this country for healthcare for all had we passed SB 562. But he froze it. It wasn't just him alone. It was the trinational corporations, the pharmaceutical companies. You know all that. But if I stood up here and told you, if I told you that we're winning, I would be lying. We're not winning. We're losing. We're fighting back. We're getting more powerful. We know what to do. We know how to fix it, and so do they. Ask them. They're never confused when it's time to fund a war. They know exactly how to fund a war. They know exactly how to create refugee camps. They know exactly how to pay for bombs and drop them on countries. They know exactly how to sign agreements like NAFTA and today's UMSCA that is creating forced migration and creating homelessness and hurting our environment. They know exactly how to do that. But they're dumbfounded, they're confused when it's time to funding healthcare for all and to fix the homeless crisis. We're losing. And we're not going to win until everybody pays attention to everyone who spoke here. And we're inviting you to come out on May 1st to march with us. And we're going to end up at the Federal Immigration Building to talk about the failure of the immigration crisis in this country. Farm workers are picking the fruits and vegetables that end up on your tables every day through extreme weather conditions, and they don't have health care. They're dying from pesticides to bring you pineapples and kiwis and sweet peas and broccoli and tomatoes. Right here in our backyard in Yolo County we are the tomato king industry. Right here, farm workers are picking the tomatoes. And farm workers today do not have the right to organize, and they're not getting paid overtime in the 5th largest economy in the world. We are losing, but we can win. We can win by uniting together, coming together, and start doing exactly everything that my dear Dr. Brunston said, what Harpreet Shima said, who's running for Congress out of District 9. And by the way, this has nothing to do with your organization, but our organization, which is a 501c5, we did endorse Harpreet Shima because we believe in him. We believe he'll go to Congress, to Washington, D.C., and he'll fight for the people because he understands the system. He understands the way it works and who's getting paid and who's not getting paid. And today I can tell you that the workers, the media is not covering workers' issues and the strikes today. You have organized and unorganized workers all over this country who are fighting for a union contract. And they're winning. They're winning because they're coming together and they're fighting on the front line. My father fought his whole life. Al Rojas, who passed on March 20th, 2021. Y aquí estamos todavía. ¿Sabes por qué? Porque no nos vamos. We're not going to leave until we win. Even if it means it takes the next generation to win, we are not going to stop fighting till we win. Join us on May 1st on International Workers' Day. If not in Sacramento, in your own pueblo, in your own city, but join the movement today. Because the attack on workers is international. It's international. This imperialist war that's going on with Russia and Ukraine, it's a long story. We know what the history is, but the bottom line is that workers in both countries and workers around the world are affected by that chaos and that war. And we need to shut that war down. That war is not good for any living thing, human, woman, child, family. And the gas prices are too damn high in this country. We're almost at $7 a gallon. That's a crime. It's a crime to pass agreements that hurt people and families, and it's a crime to drop bombs on other countries, and it's a crime to sell bombs to another country in order to show some form of defense when we know that it's affecting workers all around the world. March with us. Bring your signs. Bring your pets. Bring your family. On May 1st, we're going to march out of SCIU 2015. We're going to march to the Democratic Party headquarters to remind them that they're failing us. They have failed us. And then we're going to end right here on Capitol Mall at the Immigration Building to talk about the failure out of the Washington, D.C. on the immigration crisis. They haven't shut down ICE prisons. They have private prisons still operating. Kids in cages. We're complicit in this type of Nazi organization of money. And I also want to throw a shout out to Bill Dodd, the senator out of Yolo County. Bill Dodd takes GEO and Civic Corps money. That's the same money that funds the private prisons that put kids in cages. I want to say, how do you sleep at night, Bill Dodd? How do you sleep at night taking all this money from people and families and people being so affected and dying? How do you sleep at night, all of you? And to Cecilia Curry, who's the assemblywoman out of Yolo County, shame on you for always acting like you're confused about passing health care for all, even though you have voted yes on it. But we all know you voted yes because they were already killing it on the floor. But you've never come out publicly to say that you really believe in health care for all. Shame on you. All of you should be voted out. And I also want to say that it's everybody's responsibility at some form and at some level to be involved in their pueblo and to pay attention where the federal and state money goes to. Because right now, the attack on public schools is very real, and that means that's an attack on teachers, on students, and that's an attack on workers. I stand on this land that we also call Aslan. I stand on our people's land. I am not an immigrant, I am a native of this land. And I will tell you that as a native woman, it is a crying shame that the same people that wine and dine in Europe with England and many other countries, and in Japan, they all have health care for all, but we don't. Think about that one. Thank you very much. Me llamo Desiree Rojas, and it was an honor to speak before you.
Thank you, Desiree. Thank you so much. So yeah, really excited about marching with you on May 1st. So as I said, I'm an immigrant, obviously Asian, transgender. And what it comes down to, I believe, like all of us, it'll be people's fight. So all of us coming together and fight together. So that's why I'm really excited about, joining Desiree on May 1st and march with farm workers, march with Latino brothers and sisters, because we are all in this together. And I don't just mean that as a part of speech, I really believe that. So before I bring up the last speaker, I just want to take a bit of time doing a visual part of this important event. So I'm actually going to read a poem that I wrote at the request of Scott and Anna Dinoye. And so when I read this, I would like you to think about, or even say, the names of people that you know that's been lost because murdered by the for-profit system of healthcare, because this is for them. 68,000 say their names. 68,000, the number alone may not mean much, but what matters is each and every one of those 68,000 lives. It was my mother, your son, her sister, his brother, her wife, his husband, their grandma, her father, his daughter, their grandpa, your friend, our neighbor, our beloved. 68,000. When they're reduced to a number, they become statistics. We do not let them. 68,000 counted and others unaccounted for, all nameless, faceless. No, we do not allow them to become a nameless, faceless, voiceless number. We honor their legacy by naming them. Say their name. It was your Danny, Alyssa, Mary, Johnny, Masako, Kim, Jose, Mohammed, Gloria, Ezra, Michael, Michelle, Lila, Gabriela, Alexandra, Caleb, Isabel, Omar. Say their name, so they will not be forgotten. Say their name, so their stories will not be erased. Say their names so those with blood on their hands will hear them loud and clear. Our loved ones, even when they were alive, they were already made into another kind of number. Their illness, pain, suffering, breath, heartbeat, blood, and organs each came with a price tag. With a calculator in their hands, insurers and big pharma decide who gets to live and who is left to die. But I ask you, if their lives are so precious, would we do anything to save them? For their lives are indeed priceless. We are this fabric called the United States of America. When one of us is left to die, we start to unravel. The founding ideas of America, equality, rights, liberty, opportunity, and democracy are in tatters. Our own humanity gets chipped away bit by bit every single day while we stay silent. Do not let them. Say their names so we will remember them. Say their name so we will give them a voice. Say their name because they are not numbers. They are our loved ones. We constitute this fabric called the United States of America. And when our rights to healthcare, life, and happiness with our loved ones are restored, then and only then we shall be whole again. So please observe a moment of silence and think about our loved ones, neighbors, and friends. Thank you. So I'm going to bring up our last speaker, Noah Buchanan, who has become a dear friend of mine. He is a mental health professional, educator, transgender rights activist. So thank you so much, Noah.
Thank you very much. I'm very honored to be here. First, I want to give my condolences to the lawyers. Unfortunately, in mental health, this type of practice is common. I'm referring to the attitude that human beings are walking dollar signs. This attitude is part of what makes up the mental health stigma. I have held many positions in this field. I've been an ABA therapist, a crisis worker, a caseworker, and recently a mental health therapist. I can personally say each individual who has come into this profession has a good attitude and has good intention, but it is quickly disintegrated by the corruption from our healthcare industries. In short, our field presents itself as very contradictory. On one hand, it says that we need to practice self-care and we need to treat human beings as they should. But behind the mask of closed doors, that's not what's being practiced. Even as a trans guy, trying to be a part of this field has been challenging. An example, our field promotes inclusivity, but behind closed doors, the hypocrisy shows. During this time in this field, they do not like it when we use our voice. Give me just a second here. So the reason why turnover rates are high in this field is because they toss the authentic professionals out when they use their voice, when we try to advocate for our clients. Another point to make is because we're mental health professionals, we are advocates. Because of the invited corruption from the healthcare industries, most are silent or they compromise their values and they forget why we're in this field. The reason why we're in this field is because human life is valuable. We only live once. Mental health is a requirement for survival. No one should have to pay $300 to see a provider. More importantly, not being able to pay, we shouldn't be punished for it. The corruption that is occurring in healthcare is literally killing human beings per minute. Even with the trans community, we go through this torturous loop in healthcare. Some of us are discriminated by direct providers. However, the worst kind of oppression that we're facing from healthcare industries is the fact that we're not able to get the things that we need to live authentically, such as our hormone treatments, such as surgeries. So I want to ask everybody, what is stopping everybody from using their voice? You all have permission to use your voice. Just because we got people that want to use intimidation and threats, do not let that stop you. If fear is stopping you, please don't let it stop you, because you are not alone in this fight. We are all in this together. Healthcare is a human right. Let's stop this injustice. Let's stop this corruption. By educating everybody the importance of mental health, we are able to make a dent in the stigma. And the only way we can get this stigma to make a dent is if we remove the healthcare industries out of it. I want to thank you so much for giving me the opportunity to speak.
Thank you so much. Okay, thank you. And this is actually official end of the program, and two things. So okay, two things. Thank you so much for coming, because it really was very, very important to me personally, being a friend of the Noyars, that we will gather here to honor Danny, and also, you know, as we all mentioned, others who are victimized by the for-profit system of healthcare every year. So yeah, I really, you know, from the bottom of my heart, thank you for being here to speak and to attend, because we need this. And this number may feel small, but I promise you, we will not stop and until we get mass movement for healthcare, because that's what we need. So, okay, so I hate to do this. This is the part that I hate the most. I'm pretty good at fundraising for other people, but not for like myself or my organization. But we are Red Berets, nationwide coalition of healthcare justice organizers and activists, and I have actually some berets today. So if you would like, or if you in the need for berets, I'm selling them. So please see me after the event. So thank you. Oh yeah. It's a suggested donation of $40 and up. So yeah, thank you so much. Oh yeah. Okay, so one thing, lastly, we actually want to take a photo in front of this cursed building. So yeah. So if you can grab a sign, there's this says like healthcare for all, right? Yeah, okay. So yeah, we need like people, I don't know how many, I can't count, but yeah, grab a sign and line up here so that we can take a picture. Thank you so much.
Number 4.
I'm 9.
Yeah, I'm 8. Here you go. Come on. We need 3 more. I need 2 more. I need 3 more. Number 2. Above your head. Above your head. Hi.
See your faces.
See you. You got it.
Need the E.
Okay, what are we missing? We're missing one. Turn it around, doctor. Doctor, turn it around.
Sorry.
Is it cool?